Hello, welcome to today's episode of Case Review. My name is Dr. Ne, and before we go further, I would like you to watch this clip of video and we are going to learn something from it. I'll be back. All right, thank you for your time. The issue is not the fall of the woman, but what made her fall. Because she was wearing high heel. There are things we do that could later on in our life as we age lead to chronic joint pain. Wearing long heel is one of them. It might be fashionable, but it might not exactly be very good for your health. The reason is because when we walk, we land one foot after the other. And as we are stepping on the floor with our foot, the part of the foot that lands on the floor first is the heel. And that's why the heel is fashioned in such a way to withstand the weight, because our entire weight practically is transferred to that heel before the forefoot now touches the floor and will spring up again and all that and continue to move. So when we are walking, as our heel touches the floor, 90% of our entire weight is transmitted to the heel, then 10% to the forefoot, and that's how it goes as we walk. But when somebody wears high heel, this normal distribution of weight changes. It is now distributed 50-50, 50 to the heel, because the high heel has lifted the heel up, transferring most of the weight now to the forefoot, and it becomes 50 in front and 50 at the heel. The front of the foot, which usually carry 10% of our weight, is at this point carrying 50%, 40% increment, and it is not designed to do that. That puts a whole lot of strain on the ankle. Not only the ankle, there is an apron of tissue under the foot, which is known as plantar fascia. That apron of tissue is also subjected to a whole lot of strain. Therefore, people that wear high heel habitually are more predisposed to developing what is called fasciitis, pain at the foot. Now, ankle pain, because the ankle is also not stable. The woman fell down because of instability. She wasn't really very stable because of the surface area of the shoe that is touching the floor, which is very tiny, as we know, the tiny point of the high heel. So that makes the person wobble as the person walks. And that puts a whole lot of strain on the ankle, the knee, the hip, and the lower back. That strain amounts to pressure on the ligaments and even the muscles. At the young age, no problem. But in the late 40s, 50s, 60s, at that age, one begins to realize or experience the consequence of what happened or what we were doing at a young age. So it might be fashionable, but it is not healthy to habitually wear long heels. This is commoner among people that work in corporate organizations and corporate world. To look corporate, many of us think it's wonderful to wear high heel. But while you wear that, realize that you might be predisposing yourself later on in your life to chronic joint pain because of the continuous strain and stress you have mounted on your muscles and the ligaments of your joint. Thank you very much for your attention. I want to believe that you learned something from this short lecture. If you have any questions or comments, please do so on our comment sections and we are going to return back to you. And if one has chronic joint pain already, as I always say, joint pain don't exist on their own. They are due to what has happened over time, leading to degeneration of the cartilages and ligaments of the joint. So for this degeneration to be healed, one needs a treatment that's known as regenerative therapy. That is an advancement in science and a novel treatment for chronic joint pains. Don't depend on medications. That joint can be healed, and it is through a treatment known as regenerative therapy. If you want to know more about regenerative therapy, you can contact us on this number displayed on the screen. For the benefit of many that you know, because many of us are languishing in ignorance, you can send this videos to your friends and relatives so that they can learn and do things that can prevent them from developing chronic joint pain or arthritis later on in their lives. Thank you very much.